So you have a cold and your doctor won't give you antibiotics. Why is that? Welcome back to today's episode of The Physician Gardener. I am Dr. Kashidi Long, your board certified internal medicine and lifestyle medicine physician. And today we're going to be talking about whether you need antibiotics for your cold or not. So, most colds are caused by viruses, which are tiny particles that need a host to survive, as opposed to bacteria, which are single celled organisms that can survive and replicate on their own. So, viruses get inside your body and they go inside of your own cells, and then they use your machinery to replicate and cause havoc. Bacteria are outside of your cells and they just replicate on their own in the right conditions and cause havoc that way. Antibiotics are are compounds that are formulated to attack specific areas on bacteria. So that would be the bacterial cell wall, certain DNA proteins or other proteins inside the bacteria that are needed to replicate. Because viruses are smaller particles that do not have cell walls and cannot replicate on their own, antibiotics do not treat viruses. So I'm going to repeat that. Antibiotics do not treat viruses. There are some specific antivirals that are available for certain conditions like the flu and COVID-19, and those are pretty much the main ones that have viral treatments for upper respiratory stuff. Um, Other than that, most viruses do not have specific treatments. The focus of treatment when you have a viral upper respiratory infection, be that just the regular common cold with runny nose and congestion and sniffling, or even most sinus infections, are caused by viruses. And so you get a lot of pressure and congestion in your face. Um, the treatment is symptomatic. So that would be taking things or doing measures that treat congestion and sore throat and runny nose. And a lot of those products are available via home remedies or over the counter. So, overall, your doctor isn't giving you antibiotics for your virus or for your upper respiratory infection because you don't need them. Because statistically speaking, 90% of upper respiratory infections are going to be caused by viruses, and the vast majority of those are going to get better on their own. They've done numerous studies that have shown that taking an antibiotic for a viral infection does not speed your recovery, does not make you get quicker, faster, and does not improve your symptoms. So basically, you would be taking a medication that has a lot of risk of side effects and it's not giving you any benefit. So antibiotics can cause nausea, they cause vomiting, diarrhea, the worst form of diarrhea, which is C. diff diarrhea. And then you can also have allergic reactions, which will also oftentimes send people to the emergency room for the reaction. And if it's a severe reaction, then you need more medicine to treat that. And then what else? Oh, overuse of antibiotics has also led to a lot of antibiotic resistance. So then when you really do need the antibiotic, there's nothing you can take. And then, you have to take these really high powered combinations of drugs with even worse side effects for something as simple as a UTI because you took antibiotics for the cold and you didn't need them. So, back in the day, they did prescribe antibiotics a lot, and even sometimes you still will see people getting antibiotics prescribed for regular colds, but most of the time it is not indicated. Now, there are special circumstances when you may need antibiotics, as because occasionally a virus does progress into a bacterial infection because your immune system is so weakened, then that allowed bacteria in to infect you. But usually that is if you have a prolonged illness course greater than 7 to 10 days, if you're already immunocompromised, or if you're a high risk person with asthma or some type of lung disease, or if those are the main ones. So in general, you do not need antibiotics for your cold. You especially do not need antibiotics for your cold that started this morning. If you feel like it's more severe than a cold, then definitely see your doctor and ask for further testing or assessment. But regular common cold symptoms, you don't need antibiotics. Let me know in the comments if you have any questions.